Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you all with open arms. I'm Aspie. I'm all about creating mental health and awareness, sharing my life stories with Asperger's syndrome and the like. Just to give you the lowdown, also I do other various topics, not just mental health and awareness. I share my life stories, obviously, even though my aim of that channel was to create mental health and awareness versus obviously sharing the life story of Asperger's syndrome, especially just awareness on Asperger's syndrome, because obviously here in New Zealand there's not much of the topics being talked about, so I'm still at the moment currently looking for some other topics under that playlisting, so that will hopefully come into effect, as well as some other ones, as well as the Beauty from Ashes playlist is a variation of just encouragement, support to you all to be a mental advocate, so that you can gain clarity, understanding to maybe why you're struggling or whatever it may be, and hopefully maybe based on my personal opinions that you can respect that, and give and take. I'll respect yours. I just want this channel to be as user friendly as possible. Okay, just to bear in mind, I'm trying to tidy up just at least as much health and general topics as well as mental health topics. I know there's going to be a lot of range of this, even though we'll do as much as I can for the 3 weeks and leading up to my nitty-gritty topics, and I'm hoping to bring out as well as hopefully some more events that I'm going to hopefully go to and actually show you all what's happening in the local area and whatever. So just to be a disclaimer, as always, I'm no medical doctor. I'm just your normal Joe vlogs sharing my life stories. If you see any warning signs and symptoms regarding to any of these topics I share, seek professional help for yourself or for your loved one, or even a second opinion. And also feel free also just to smash that like if you're liking this as well, just to give me the heads up so I know where I'm at, or just engage with me somehow. Also, basically, just a heads up, with all these tips and tricks that I may bring out, regardless of what I do for myself may work for me and not for you, and vice versa, what you do for yourself may not work for me and work for you. Give and take, respecting it. And also just in mind, if I do some step-by-step, tips and tricks on how to manage some everyday things that has been already listed in some of my video series, maybe I encourage you guys just to try them and see if they will work for you. It may not guarantee to be a quick fix, straight in one day when people expect it. It may take, a few weeks, and the motivation and determination and that mindset of ours just to get up and go and do it. So enough further ado, guys, basically this is another all about series, and this one's all about Huntington's disease. Hopefully you're learning something along the way. Basically I thought to share these obviously because at the end of the day we need to know about these things, obviously, and I'm going to educate you all somehow, one way or another, as well as to support you in any way I can. So let's begin this. As we know, we tend to question what is Huntington's disease. So Huntington's disease, however, is a progressive brain disorder that causes uncontrolled movements, emotional problems, and loss of thinking ability, which is your cognition. Huntington's disease is a rare inherited disorder involving the progressive loss of particular nerve cells in the brain. This disease, however, is characterised by maybe dementia from memory, as it gradually increases severity, leading to the need for full nursing care. I could be wrong, even though Alzheimer's, dementia, and all these other forms of dementia comes into practice, which I'll share more on later on, or it may come on now. The onset, along with signs and symptoms of Huntington's disease, however. Adult onset Huntington's disease, the most common form of this disorder, usually appears in a person's 30s or 40s. Early signs and symptoms can include irritability, depression, small involuntary movements, poor coordination, and trouble learning new information and making informed decisions. Many people with Huntington's disease, however, develop involuntary jerking or twitching movements known as chorea. If that's pronounced right, forgive me on the clinical terms. As the disease will progress, obviously, these movements become more pronounced. Affected individuals may have trouble walking, speaking, and swallowing. People with this disorder also may experience changes in personality and a decline in thinking and reasoning abilities. Individuals with the adult onset form of Huntington's disease usually live up to 15 to 20 years after the signs and symptoms has begun. A less common form of Huntington's disease is known as the juvenile form, which obviously begins in childhood or adolescence. It also involves movement problems and mental and emotional changes. Additional signs of juvenile form include slow movement, clumsiness, frequent falling, rigidity, slurred speech, and drooling. School performance will then decline as thinking and reasoning abilities become impaired. Seizures occur in 30% to 50% of children with this condition. Juvenile Huntington's disease tends to progress more quickly. Well, affected individuals usually live 10 to 15 years after signs and symptoms are cured. The average age of onset is 35 to 44 years old. There are both physical and psychological symptoms that may vary from patient to patient. So the early signs to look out for are slight uncontrollable muscular movements, clumsiness, loss of short memory, inability to concentrate. Then they may accompany by mood swings, depression, uncharacteristic aggressive behavior. As the disease progresses, the symptoms will become more severe, and those ones will include the following. The involuntary movements become more pronounced. The psychological problems will worsen. The patient may experience weight loss. The patient may have difficulties with speech and swallowing. Lack of motivation may lead to depression, and sometimes even the simplest task may seem impossible. Full nursing care may eventually be needed. Huntington's disease is fatal with an average life expectancy of 20 years after onset of symptoms. Muscular difficulty in clearing the lungs can increase the risk of pneumonia, a common cause of death. Genetic changes. Mutations in the HTT gene can cause Huntington's disease. So I'm going to have an image hopefully to show this so that you can see what I'm talking about. The HTT gene provides instructions for making a protein called Huntington. Here's the name, even though it's named after a guy called Huntington too. Although the function of this protein is unknown, it appears to play an important role in nerve cells, or the neurons, and in the brain. The HTT mutation that causes Huntington's disease involves a DNA segment known as a CAG trinucleotide. Repeat, this segment is made up of a series of 3 DNA building blocks, cytosine, adenine, and guanine, that appears multiple times in a row. Normally, the CAG segment is repeated 10 to 35 times within the gene. In people with Huntington's disease, the CAG segment is repeated 36 to more than 120 times over. People with 36 to 39 CAG repeats may or may not develop the signs and symptoms of Huntington's disease, which people with 40 or more repeats may also almost will always develop this disorder. And an increase in the size of the CAG segment leads to the production of an long version of the Huntington protein. The elongated protein is cut into smaller toxic fragments that bind together and accumulate in neurons, disrupting the normal function of these cells. The dysfunction and eventual death of neurons in certain areas of the brain underlie the signs and symptoms of Huntington's disease. The diagnosis. Tests for Huntington's disease are offered to individuals with a history of disease in the family. These will comprise of a neurological examination that will assess 1. Your reflexes, 2. Muscle strength and tone, 3. Sense of touch, 4. Vision and hearing, 5. Coordination and balance, 6. Mood, 7. Mental status. And the next stage is over. Then individuals are often referred for a psychiatric evaluation to assess the emotional state, behaviour, evidence of substance abuse, coping strategies. The next step also is that the doctors may ask for tests to examine the brain with brain imaging tests, for example MRI or CT scans, electroencephalogram if an individual has experienced seizures, and can help identify areas of the brain that aren't working properly by picking up on the brain's electrical signals. Genetic testing to identify the mutated HD gene is also an option to confirm a diagnosis for Huntington's disease. Predictive genetic tests can be given to someone who has a family history of the disease but currently shows no obvious symptoms. Genetic testing is performed with extensive genetic counselling to help individuals come to terms with what the future may hold for them if they do test as positive. Treatments. There is currently no cure for Huntington's disease. The symptoms can be alleviated in a number of ways to improve quality of life. Drugs can be given to prevent involuntary movements and control mood swings and depression. Speech therapy can be given to improve speech and ease swallowing. A well-balanced diet can prevent weight loss and may have a positive impact on other symptoms. Prenatal tests for Huntington's disease are also available, but there are ethical concerns associated with terminating pregnancy following a positive result for Huntington's. This is because an individual may develop the disease when they are in middle age and could spend the majority of their lives happy and healthy. Well, this quickly ends, obviously, all about Huntington's disease. Give me the like, 4 thumbs up for sport, comment below if you missed out anything. Feel free to subscribe to my channel because I do this on a daily, weekly, Monday to Friday. Feel free to put the notification bell on so you know when I'm out and about doing the updated versions of the videos of whatever you may want to see. feel free to share these videos around to family and friends. So in all further ado, guys, thanks for the support, thanks for watching, do what you love what you do. Until next time, see you again soon. Ciao for now.